Our bodies are brilliant survival machines, but they have one massive design flaw. They are incredibly good at hiding their own systemic failures from us. Non-communicable diseases, things like high cholesterol, early-stage liver distress, or insulin resistance, quietly compound over time. Notice this line representing internal damage. It creeps upward in the silent zone for years, staying well below the threshold of physical symptoms. Standard reactive healthcare relies on this flawed biology, waiting for the patient to feel sick, treating only after the symptom threshold is crossed. It intervenes here, at the peak. Preventive medicine operates in this earlier window, catching issues before damage becomes irreversible. This gap exists because organs like your liver and kidneys are highly efficient at compensating for damage. They work harder to mask internal tissue degradation, leaving you without a single warning sign until the failure is severe. We can call this the vacuum of care, the dangerous, invisible period between the microscopic onset of a disease and the eventual moment a patient actually feels sick. Relying on physical symptoms as your primary gauge of health is a flawed survival strategy. By the time your body alerts you to a problem, the most critical window for intervention has likely passed. Modern pathology bypasses the limits of human sensation, using preventive screening as an early warning radar system to detect what we cannot feel. Specialized facilities like Dr. Yadav Path Labs utilize 25 years of diagnostic expertise to look deeper than a basic checkup, possessing the infrastructure to run more than 5,000 distinct tests. A master health checkup maximizes this capability. A single blood and urine sample cascades into a matrix of 149 distinct parameters, evaluated simultaneously to provide a complete biological profile. This visualization allows us to isolate specific data clusters, verifying the precise function of your renal system, your endocrine health, and your cardiovascular risk markers in one pass. This volume of data shifts diagnostics away from guesswork. It provides a high-definition, predictive map of a patient's biological future. These maps are built using biomarker panels, sets of specific tests designed to measure the holistic function of an individual organ or system. These panels transform a single vial of blood into a comprehensive intelligence report detailing a patient's exact odds of survival. Consider the lipid profile. It flags hidden cardiovascular risks, like microscopic arterial plaque buildup, long before a heart attack becomes a physical reality. Precision testing changes the perspective. While a standard blood sugar check might fluctuate wildly based on your last meal, an HbA1c reading provides this perfectly stable trend line of your average glucose over